And turning our attention to our health news, your thyroid may be the issue behind a lot of your health problems. Our Leah Lynchine and Chris Stanford have more in this week's health conversation with Dr. Roopa-Shah.
Here's something you might not think a lot about. Your thyroid.
But it's an important part of your health. Though, how do you know if it's working? SSM health physician and wellness coach Dr. Roopa-Shah joins us now with more. Good morning, doctor.
Good morning.
So let's start with what exactly the thyroid is and what it does.
So the thyroid gland is a small little butterfly-shaped gland just right here below the Adam's apple in the neck. Normally, you can't see it or feel it, but if it enlarges, you might start noticing a little bulge or some swelling in your neck, especially when you look in the mirror, or somebody else may look at you and kind of notice that you've got a little swelling there. And this is something that you should be getting checked at your annual physical exam. The thyroid gland actually secretes thyroid hormones, and those hormones are very important because that's what help controls the speed at which all of our body's chemical functions proceed at. So people like to think of this as the metabolic rate. So it's very vital in controlling our metabolism.
Interesting. How do you know if your thyroid's functioning well enough?
So one of the easiest things that can be done when you go to your doctor's office, we can do a blood test in the office called a TSH. We can also do some free thyroid hormone testing called T4 and T3. But for most people, generally the TSH will be the best indicator of thyroid health. The TSH might be high if your thyroid is underactive, and it might be low if your thyroid is overactive. So again, it can be just a quick blood test that you can ask your doctor to perform if you're having any symptoms related to thyroid disease.
What are some of those symptoms?
So there's quite a few, but the biggest ones that I've noticed patients experiencing are weight gain and fatigue. But there's a lot of others too. Increased sensitivity to cold, constipation, dry skin, dry hair. Some people might look a little puffy in their face, a hoarse voice, muscle weakness, and just even feeling generally achy and stiff also. So listening to that list, you may think, oh, I have a lot of those symptoms. And it's quite possible you have a thyroid disease, but it's best to go check with your physician again and get some of those blood tests done to see if you actually have hypothyroidism.
Yeah, well, what about hyperthyroidism? Talk more about that. Tell us about it.
So hyperthyroidism is sort of what it sounds like. It's an overactive thyroid. So it's the opposite of being too low on your thyroid. This occurs when your thyroid gland actually produces too much of the thyroid hormone. And hyperthyroidism actually can accelerate your body's metabolism, but not in a good way. This can cause unintentional weight loss. People can have a rapid or irregular heartbeat. Some other symptoms, as I mentioned, weight loss, pounding of your heart, like you might have palpitations, increased appetite, feeling nervous or anxious, irritable. You can have more sweating, irregular periods, changes in bowel habits. So lots of other symptoms associated with hyperthyroidism as well. I always like to mention that if you're feeling like you're more anxious or nervous or having panic type attacks, this is another really good test to have done at your physician to make sure it's not caused by an overactive thyroid.
Can these conditions be treated?
Absolutely. So both of these conditions can be treated. If you're low on your thyroid, your doctor can prescribe a synthetic thyroid hormone to kind of replace that thyroid hormone your body's not making. And in the case that you're making too much thyroid hormone, we also have some treatment options that can help suppress your thyroid from producing all that excess hormone for you too. So it's really ideal to check with your physician if you suspect that you have any of those symptoms that I talked about earlier.
All right, great information this morning. Dr. Roopa-Shah, thank you so much as always. And if we want to learn more about what you're up to, where can we find you on social media?
So you can find me on Facebook or Instagram at Wellness with Dr. Shah.
Thank you very much for taking the time this morning, doctor.
Thank you, guys.